A lot of changes happen during the second half of life. Join Kash Mahmood, owner of Varco Hospice and Home Health, and his guest as they explore topics to help you navigate the second half of your life. And now, here's Kash.
Good morning, everyone, and welcome to Second Half of Life with me, Kash Mahmood. Our very special guests today are Wendy Spiller, Jonathan Lowe, and Chad Neimeyer, with dedicated senior medical care. Today, we will be talking about a new concept in senior medical care. Well, welcome, and thank you for joining us today.
Thank you.
Wendy, I'd start with you. I'd like to ask you to please do a quick introduction of yourself and your team, your roles, and a little bit about what you all do at Dedicated Senior Medical Care.
Absolutely. So I'm Wendy Spiller. I am one of the member growth consultants. We also have Jonathan Lowe, who is our director of growth for our Houston area. And then we have our esteemed Dr. Chad Neimeyer. He is also our medical main director here in one of our centers here in Houston. But our company, we are actually our dedicated senior medical center is a primary care doctor's office. We are here for seniors who are on Medicare or Medicare and Medicaid. And we like to say our motto, the model, which Dr. Neimeyer, I'm sure we'll get into a little bit later, is what has us different from other parts of other medical centers or other doctors' offices. We specialize with senior care, and as my role as a member growth consultant, we actually go out into the community and we introduce dedicated to the community, letting them know that we're here for them. We actually assist. We'll go to assisted livings, we'll go into churches, we'll go into community centers, wherever seniors are. We'll actually get out there and let them know that we're here in the community for them.
Well, Wendy, dedicated senior medical care is certainly a new concept in senior care itself. What makes you guys different?
What makes us different, and I know Jonathan will come behind me and add on to this quite a bit, but what makes us different is we actually care. We really care about our patients. The model, again, that I'm sure Dr. Neimeyer will mention, is a model that will actually show the care, the love, the respect that seniors deserve so that they can get that better health. We're different. We just are. We are different. And seniors know that when they come in and when they see us and they talk to their doctors, they get that one-on-one, the time that they spend with their doctors, they will feel that not just their doctor cares, but the whole staff really cares about them. How often we stay in communication with our patients. There is a love at Dedicated that is nowhere else that I've ever seen. And our seniors do know, and they will feel that.
Wow. So it's really the experience all the way through when they come in, and excellent. That's amazing.
Absolutely.
Chad, as a physician, what attracted you to this new model of care?
That's a great question. Thank you. So I've wanted to be a primary care physician since I've wanted to be a doctor. And it was the relationship with patients that really motivated me to go in that direction. And I've had other experiences before I came to Dedicated Senior Medical Center. And what I'll tell you is that what the traditional model, what we call fee for service, I did not feel that I was in a place that was set up and resourced to serve patients well. That model is really volume centric. They want to see as many patients as possible, and ultimately that's the motivating factor. So as you can imagine, seeing if you have a panel of 2,000 to 2,500 patients, it's harder to know your patients. It's harder to really see them as often as maybe needed in their case, to really build that relationship, which is, like I said, my primary reason for being a doctor and my primary reason for being a primary care physician. So at Dedicated Senior Medical Center, this is a different model. We talked about the model. It's a value-based care model, which means that ultimately our success as a company and as a clinic is tied to the success of the patient. We are tied to their metrics. We follow and make sure that their diabetes is under good control, their blood pressure, they're getting the screenings that are needed, that ultimately their health care that is provided is quality health care, and that ultimately is good for the patient, and then ultimately good for us as a company if we're doing well, performing well there as well. So as a doctor, as a primary care physician, that also limits the panel size. So I see a smaller subset of patients. Our PCPs, our primary care physicians, see no more. They have no more than 450 patients. And you know what that does for me is it allows me to really go deeper with my patients, to have a relationship with them. My patients have my cell phone number. They can call me after hours or on the weekends, which is something unique that I think a lot of places may not offer, where if you have a crisis or if there's an issue that comes up, no longer are you going to have to call and wait and be pinged around in a contact center and never get the answer to your question. You get to call directly to your doctor, someone who, through the system and the model that we have, you've built trust with. And that that knows you well. And ultimately that, I think, leads to better patient satisfaction. It leads to a better, more rewarding experience for me as a primary care physician, because I believe that I'm in a position to serve my patients well and deliver on the care that we promise. And I think that that's something that's lacking in most of the traditional models. And that's why I came to Dedicated Senior Medical Center, and why I want to continue to do that work here every single day.
Well, Dr. Neimeyer, that is certainly amazing. Having a doctor's personal phone number when you need it, you don't hear that every day. So that's great. As a physician, why do you feel it is important for seniors to have consistent primary care?
Well, I believe that primary care is the foundation of good health care. So primary care, we are ultimately, we're generalists, right? So we manage a broad array of medical conditions. Diabetes, high blood pressure, coronary artery disease. Certainly, it's really ideal for a patient to be able to have as much of their medical care housed in one place with their primary care physician, where they can go and know that they have a trusted doctor who knows all of their health conditions and their complete picture of their health. So ultimately, having a good primary care physician, someone that you trust, can save you in terms of lack of coordination of care, which is so common in the rest of more traditional models, where you see Dr. A, Dr. B, Dr. C, and none of them are communicating with each other. Ultimately, errors occur and things fall through the cracks, which can impact the patient's care. Well, if I am, and I like to say that I'm, the quarterback of the care team, ultimately we are leading. And so if we need to engage with specialists, which of course is necessary at times, then I'm still very much involved. I call that specialist calls me. We coordinate and make sure that care that's being provided is smooth and seamless. We take ownership over the screening of patients and prevention of disease. So it's not only important to me that I control the diseases they may have, but also it's important to me that I help identify where there's risks for other diseases down the road and mitigate those risks now so that it doesn't become a problem later. And so that allows us to really prevent illness before it becomes a challenge for my patients. And that's a large reason why I do what I do as well. So I think the focus on prevention, the focus on wellness, and the focus on communication and coordination of care, that's something that is unique to primary care, and one of the reasons why I love what I do. And I think that it's something that allows patients to really navigate what can be a pretty scary and daunting system at times, to be able to partner with them and make sure that they have the best health care.
Yeah. Kash, Dr. Neimeyer alluded to giving the phone numbers out to their patients. And the good thing about that too is not only does it assist them with their medical concerns, but it also helps the patient financially. If they typically they will just go to the ER or go straight to the hospital. Or in this case, they can call Dr. Neimeyer or their physician beforehand. Maybe it's put your legs up, or maybe it's something like that, as opposed to now they don't have to make that co-payment that a lot of them are having challenges with. So that's another reason why it's good to have that. We like to be accessible to our patients. Yeah.
That's actually a very good point, Wendy. I mean, in fact, it's along with the payment or the copay that somebody has to do at the ER. It's also the stress of going to the ER, right?
Absolutely.
So, yeah,
And Kash, there's something about that as well, to Wendy's point and Dr. Niemeyer's point. What's going on here in our society is that a lot of individuals don't have access to primary care, or they don't have a primary care physician. So their alternative, a lot of people will say, well, Jonathan, they can actually go to urgent care. Well, the problem is urgent care is going to ask for money up front. So we are actually helping some of the neediest population. And individuals that don't have the money to pay up front can't go to care. So Kash, they're going to go to the emergency room, where they're going to be billed on the back end. So what happens, you have a lot of individuals going there for maybe medication to get something refilled, or maybe they have questions that they could have talked to their doctor, or they have symptoms, or maybe they're having a reaction. And see, this is something where our doctors would be available and accessible, could talk to them, could walk them through the process. And if they needed to go to the emergency room, then again, and I'll defer to Dr. Neimeyer on this, but what happens is they can talk to the doctor, and the doctor can help coordinate that. But a lot of times our emergency rooms, 90% of what's going into emergency rooms are not emergent care. It's really only that 10%. And I think a lot of people don't realize how much it's costing to have individuals go to the emergency room. And one best part about our model is we're reducing ER visits and hospital sick days, which is going to make a difference, not only financially for our members, but is going to give them better one-on-one health and care. And on top of it, one thing too, and I know we all talk about this at Dedicated, a lot of times when you go to an emergency room, you know what happens? You go in there and they stabilize you. And then it's basically what they call treat and street. But let me ask you a question. If that condition, if you had a medical emergency, like say, for example, blood glucose level gets too high, and you go to the hospital and they manage it, bring it down, and they discharge you, if you don't have any type of follow-up care, are you going to bounce back to that emergency room in 2 to 3 days? Usually, Dr. Neimeyer will tell you, what is it about? Chad, is about 24 hours that most people are bouncing back?
Well, absolutely. And I think that's a really important point, Jonathan, that ultimately an emergency room or hospital, either case, they're looking to stabilize conditions. They're not looking to optimize conditions. And I think that that's where a primary care physician comes in, is we are looking to optimize it. They may send you home after they've brought the blood sugar down to a safer level to where you're not going to have a crisis from it. But what I hope to do as a primary care physician is let's manage that blood sugar, that diabetes over time, and reach a certain threshold of what we would consider optimized care. And that will keep you from going to the ER, to the hospital, and having these crises, and also avoid the complications of diabetes down the road. And so, yeah, the expectation when you're discharged from the hospital or an ER, in either case, that's not the end. The condition that resulted in a crisis that brought you there, that may be over, but that crisis is going to come right back unless you work with someone to optimize that condition, and that's what we're there. And I think just, Wendy and Jonathan, you both alluded to this, but with the ER visits, our mantra here is call us first, okay? That's not, that number that we give, that cell phone is not just, it's not a novelty. It's not something that we're just giving and saying, here, this is something different that we do. It's something that we expect and we hope our patients will use. And we want them to call us on directly. If I get a call on a Sunday and a patient is telling me of symptom that they're having, yes, there may be times when what they're going through is needed. It needs to be assessed in an emergency room. But I can tell you that many of those times we're able to work through it together and make sure that they get the care that they need, so they don't have to go wait hours in an emergency room with care that they may not necessarily, with people that they don't necessarily know.
Well, Dr. Neimeyer, you've said a lot of things about how dedicated senior medical care is different. So I'm going to ask you the hardest question of the show. What is the difference in the doctors at dedicated senior medical care and any other doctor's office?
Right. Well, I can tell you this. We certainly have amazing primary care physicians. We have a great group, and they're carefully selected for being doctors who are board certified, of course, which is not necessarily the case anywhere you go, but it is certainly, they're all board certified with our organization, and they're doctors who really care about their patients and really are the sense that the mission of what we do is what resonates with them and what really brings them purpose and what really keeps them going every single day. And I will also tell you that in other models, in fee-for-service model, because I've worked with a lot of doctors, there are great caring doctors, but the model is not set up to serve them well, to serve the patients well. And so I think this is one of the reasons why there's frustration on both sides sometimes with patients and doctors maybe not really feeling like they had adequate time to address the health concerns that were there. And so ultimately what we do is we're trying to put that relationship, that primary care physician and that patient at the center of this whole of our model, and ultimately give the time that's needed to be able to address those concerns, to make sure that there is a clear understanding of what the disease process and what's going on with our patients' bodies, so that they can be in better health. And ultimately, I feel that it leads to a satisfaction that ultimately you may not find in a lot of other places. And then I think that allows us, it's a recipe for success. Yeah. So the doctors here are great. They're phenomenal. And I would put them against any other doctor. But I also think the model helps them to be even better. And that's what really serves our patients well.
And so just to piggyback on what he's saying too, Kash, our doctors only take on a certain amount of patients. Each one of our primary care doctors take on like 450 patients each, as opposed to like 2,300 to 4,000 normally. And they're able to spend that time talking to that patient, working with that patient, to making sure that you know your body better than anybody else, right? Dr. Neimeyer and all the other doctors are able to talk with them, sit there. But if they didn't have that time, it would be hard for them to do that, right? And then on top of that, they actually call their patients. They have this thing called love calls. It's a part of our model as well. They will call their patients on a regular basis just to check on them. And the staff that works with Dr. Neimeyer and the other doctors, they'll call them, just check on them, see how they're doing. Do you need any more prescriptions? Do you need any water? Things like that. And that's not something that's done often. Once you go see the doctor, you're in and you're out until next time you see them again. But not dedicated.
This is so great. I'm going to go off on a limb and I'm going to say you're really personalizing the healthcare experience for your patients.
Absolutely.
That's very good to hear.
Absolutely.
Jonathan, a quick question for you. Do you accept all types of Medicare at dedicated seniors?
That's actually a great question. Our model is based on Medicare Advantage. So what's going to happen is going to be individuals who are 55 and up, who are on Medicare and specifically enrolled in Medicare Advantage plans. We work with 5 local carriers, and that's going to be Anthem Amerigroup, for example, Cigna, Humana. We also have WellCare, Texan Plus, and I think I did believe I said Cigna in there as well, didn't I?
Aetna.
Yeah.
Aetna as well.
I'm sorry. Yeah, if I lose track, guys, I'm getting older.
You're good.
You'll be taking care of me. But the Medicare Advantage plan, what it allows the member is going back to what we've been talking about as far as care of the member. The Medicare Advantage plan allows the member to come in and they can see their primary care as often as they need, and there is no copay. So when you take a look at Medicare Advantage plans, generally it's $0 copay to see your primary care. So to Dr. Niemeyer's point, if you need to bring a member in, say they have a very complex issue, and you can't always address all the issues, you have to kind of do it in, let's take a look at the most emergent and work backwards. The thing is, some of our members, because of medication management, might need to come in more frequently. We need to at least see all of our members at least once a month. Because number one, if you're looking at trying to detect and manage and prevent diseases, members need to come in for regular scheduled visits. By having the Medicare Advantage plans, again, they're not going to pay anything on as far as a copay, and that's going to be good for them as well. And what happens by also doing this, we work with our carrier partners. As a director of growth, one of the jobs that I have is I go out here to local communities. I go and I talk to our carrier partners at Anthem, for example, and Aetna and Amerigroup. I talk to all of them. And what I do is I also talk to brokers and agents locally. That's important as well, because what happens is brokers and agents sit down with individuals who are eligible for Medicare, and they help them select the right plan for them. As we've all seen out here, I think everybody's being inundated by commercials on what's going on what type of benefits do you offer. I mean, you can see a commercial and they're talking about, for example, okay, well, you can get free meal delivery, you can get all these different prescriptions, you can get money back. It's really hard for the average person to navigate through all the different plans. So brokers and agents assist them. So one of the things we do, we go out and I educate the brokers and agents to what we offer. They have choices out here in primary care, but what we want is to show them what we can do. One of the things that Wendy had talked about, as far as our model and love and outreach, I want to cover the most important thing. Take everybody on this call right now. There's not one of us, and Chad and I talk about this all the time, but if I were to call my primary care doctor, I can't get into my primary care doctor. It takes 2 weeks on average, because to his point about being fee for service, for example, having, or capitative models. This is where the carriers pay, the provider practices per member per month, whether they see them or not. But they have 28 to 3,000 patients on average. Well, with us, we have the smaller reduced model and value-based care. So we can take individuals, they can have same day or next day appointments. But even if you wake up sick, you can come on in and see us, and we're going to work you in. The bottom line is, for me, I'm 52 years old. I hate to tell everybody, I can't even get in for 2 weeks, 2 weeks to get in there. And so to Dr. Neimeyer's point, I'm not going to pursue care. Do you know why? I mean, sometimes I won't pursue it because I feel like 2 weeks from now, it's taken care of. Whatever the issue that I'm sick, I'm not going to do anything with it. So this is what happens. The other thing we have to overcome out here is the obstacle. A lot of our seniors that I talk with think that they really have access to great care. And I ask that simple question. If you got sick today, how soon would it be before you get into your doctor's office? They tell me on average, it takes, it might be 1 to 2 weeks. The second thing I ask them, are you actually seeing your doctor? 99% of them tell me no. Well, Jonathan, I'm seeing a physician assistant, or I'm seeing a nurse practitioner. And I asked the question again, but do you get to see your doctor? That's one of the things that makes us different, is being able to service our members, to spend that more time with them, to have access to the doctor, to be able to call your doctor. We have other services, which I'll defer to my colleagues so they can talk about, but we have other in-house. The other thing with me, it's frustrating. If I go to see my doctor, then they're like, Jonathan, you need to go get your labs. So I have to go to LabCorp. So I have to set an appointment in the middle of the week, and I have to go get my labs done. And then I have to wait for somebody to call me back. But something? Nobody ever does. But dedicated will, though. Go ahead, Wendy.
That's true, because we do have activities that we have at our centers. Each one of our medical centers has a room designated just for our seniors to have activities. There's, Tai Chi. We actually have Bible study at some of them. We'll have bingo at some of them, and line dancing. I think we saw dominoes. They were playing dominoes, slamming them on the table, things like that. Decorating, just things that could bring a senior out of their home, because sometimes it's not just the physical, it's the emotional, right? And in this case, we can bring our seniors in to meet other seniors and to just love on them, and then they go home, what a day that's made for them, and to look forward to the next week or the next day that they can get out of the house and come in and do something different. And we also take that into some of the places that I mentioned earlier, like the churches and the activity centers. We'll take those events there. Jenga has become popular. I don't know if anybody knows about it, but it has become very popular with our seniors.
That is awesome, right?
That is very impressive. It really is. Um, with all of these services that y'all are providing, how many locations do you have in Houston? Jonathan, maybe you can take that.
Sure. We actually have 5 locations currently. We have 4 fully operational medical centers, and we actually have a temp center in North Houston. So that temp center is going to transition to a brand new center in May.
Yes.
So we are so excited. And we're going to be, and since you asked, Kash, I'm going to tell you, we're also going to be putting out flyers in the community. We're going to be doing some advertising on that. We want to bring prospective members in. We even ask our current members, if you love what we do, tell a friend. Don't be afraid of that. That's one of the things that we do, because when you take a look at our scores and our surveys, you look at our reviews, I'm telling you, you're not going to find anything better out there. But we'll do grand opening events, and we will bring, sometimes, we invite the mayor. So hopefully, I'm just throwing that out there. So if the mayor's listening to the podcast, that they'll come out. Precinct 1, we had them come out as well to our precinct 2, come out to our different events. We have community partners. We have agents and brokers that come out. We reach out each center. One of the other things I wanted to throw out there is some of the other barriers. When you talk about barriers to healthcare with our seniors, another barrier is transportation. And when you take a look at this, I talk to our seniors and say, well, Mrs. Jones, are you able to get a ride in? And they'll say, well, I'll have my niece, or maybe I'll get my nephew to do that. And we all know, unfortunately, families are not always reliable. I wouldn't want to rely on my family. I'll be honest. I'll tell everybody up here. My family would probably forget me, but the sad fact is a lot of our seniors they don't have transportation, or they have to rely on family. Well, we provide transportation. So what we do is we take a look outside of our medical center, and we take a look at a 12, on average, about a 12-mile radius. Because when you start getting 12 or 15 miles out there are Medicare rules on that. But really, we want to be close in for our members, because the closer they are, the more likely they are to come in and get care, right? So we provide transportation. Kash, whether their Medicare Advantage plan covers it or not, we pay for it. We take care of the transportation.
Wow.
And that way we find if we remove that barrier, individuals come in for care.
Right.
And if they come in for care, guess what's going to happen? They're going to have better outcomes. So
That's right.
Yes, 5 centers. We have another launch coming up, which I mentioned in May, which is going to be fantastic. So look for some of the events and advertising out there, and we invite the public and community. Even if you're not close to that center, I bet you are close to one of our centers.
Yes.
And we'd love to have you there.
Dr. Neimeyer and I are smiling because that center is going to be ours.
Yes, it is.
Very excited.
What is it, 440 West Parker? That's where we will be in May.
It's going to be fantastic.
That's certainly exciting news. I mean,
Absolutely.
from everything that I'm hearing, that's absolutely exciting.
I have to throw in, we did have an appreciation day for our seniors on Saturday. That was pretty huge here. Dr. Neimeyer was here talking with quite a few of the patients, and we provided food for them and vendors. Just a good time. And that's what we do at quite a few of all of our centers. I believe we do that.
Absolutely. And Wendy, to your point, I want to take it one step further. Do you know what also another thing that makes us a little bit different, Kash, is our doctors will actually go on site. They will schedule time where they'll go out in the community and they'll talk on different medical topics. We call them celebrity events, where we send our docs out and we coordinate with them and their schedule. First of all, care of our seniors is number one priority.
Yes.
But when they have a break in their schedule, we can schedule. It might be a local community center. They'll go over around the corner. They'll talk on a different topic, and then they'll come right back to the medical center. So
Dr. Neimeyer just did a doc walk with us.
Oh yeah.
And I love it as a doctor. It's an opportunity for us to connect with patients or prospective patients and the community. at large. And I think that's it's such an encouragement to really get out there and see, to go to different places and be able to connect with patients outside of the walls of the clinic, which, as Wendy mentioned, we do have events and activities here at the center as well. And, a lot of those things like bingo and dominoes, I consider them therapeutic. As a doctor, I actually believe that sense of community, that connection that people have, and we want to be part of that connection and that community. We consider our patients members of our family, basically. We want to make sure that they feel comfortable coming here, and that it's a place where they can come and also have a good time. It is not lost on me how important that is, that sense of community and connection to all of our well-beings. And so we prioritize that for our seniors as well. So absolutely, those are amazing events.
Wow. Wendy, how does someone get in touch with you guys?
Ooh, great information. They're welcome to give me an email at wendy.spiller@dedicated.care, or they can give us a call. I have my number 832-657-4320, and they can call at any time, even on the weekends. I would love to hear from them, and to do a tour here at the center is something that we are promoting and that we enjoy doing, actually. And that way they get a chance to meet Dr. Neimeyer and the staff, and even Jonathan, some of the center the center directors as well. So they'll know who they're going to be interacting with when they come here at Dedicated. And we also have our website that they can go out to, the dedicated.care website. And there's opportunity for them to contact. I believe there's numbers out there as well if they don't get me, but leave a message and I'll definitely call you back.
Well, Wendy, Jonathan, Dr. Neimeyer, this has been a great show. I really thank you for being on it. Very, very informative for our viewers.
Yes.
Once again, thank you.
Thank you.
Thank you, Kash.
Thank you. Appreciate it.